Trying to eat the body of an he can't.
Hey everyone, Jess here. Now, I'm giving a trigger warning. This is talking about medical and health stuff. So, if that kind of stuff bothers you, please don't watch this video. And I know I've actually been told a few times that I should stay in my lane and only do law tube or only do court videos, whatever, and only do my life stuff. Well, here's the thing. It's my life. It's my channel. Part of it is court videos. Part of it is my health stuff. So I want to share about one of the more unpleasant conditions that I have. And you'll understand why I say unpleasant in a second. This is something that I was diagnosed with as a child, and I still unfortunately deal with to this day, and I'm actually currently dealing with it for the last couple of days. So it's called cyclic vomiting syndrome, which is exactly what you think it is. Cycles of nausea and vomiting. So what it is, it's what I'll get like sudden or severe intense periods and attacks of nausea and vomiting without an apparent cause. So literally I can wake up in the middle of the night and just be like, oh, run to the bathroom and puking. It sucks, man. It really sucks. Unfortunately, there's not really any known causes. I mean, there are certain things that might be a trigger, like foods or stress or alcohol. I mean, everyone gets triggered differently. For me, most of the time it's triggered by weather changes, or like intense stress. So like if I have a major operation, I tend to have episodes a few days before, and then obviously after, well, most surgeries, if I'm under anesthesia for about an hour and a half, then I have it. I don't know why that seems to be the threshold for me, and it just has to do with the amount of medication. And I unfortunately can say that because I have lost count of how many surgeries and procedures I've had in my life that I've been under anesthesia. Like, been doing a lot better this last year, including my spinal fusion. I think it was 4 times. Because when I get like the epidurals and injections into my spine, they have to do it with anesthesia. My doctor refuses to do an epidural with me without anesthesia anymore, because he did it once in the office and he was sweating by the time he was done because of the damage with my spine. So, yeah, I cried and I was like, I'm surprised I didn't break. It was my mother-in-law had taken me, and I'm surprised I didn't break her hands because I was trying to not squeeze that hard. But I was crying, sweat, tears, breathing. It was pretty horrific. But yeah, so unfortunately with cyclic vomiting, there's not really any known causes. You kind of figure it out, and you'll have a pattern of it. So you might notice a pattern of it starts at the same time of the day, or it lasts roughly the same amount of time. Fritz, hey. Sorry, he's a jerk. People are coming home, so he's angry. Anyways. Really, mouthy dog? Come post. Fritz, post. Come. Thank you. Thank you. He's a jerk. Anyways, I know I'm smiling and laughing, and don't let that dissuade you from how I don't feel good. Fritz, post. Thank you. Like, I have been in bed the last couple of days. Up. I think I was up till like 3 or 4 o'clock this morning. And I've been eating like applesauce and drinking Vernors and crackers. And water. So it's not, I don't know. There's things I can do to try to mitigate it. If it's bad enough, or like if I start seeing blood or whatever, I will go to the ER. Or if it lasts a really long time and I can't take it anymore, I will go to the emergency room for, they call it abortive medication. I used to have stuff on hand, only because I had migraines, and I'm talking severe migraines, like three-quarter of the time out of a month. So like daily sustained migraines. So I did used to have stuff like that on hand. I don't really anymore. What I have found that has worked well for me is one of the brand names is Anavert. Meclizine is the generic name, or also known as less drowsy Dramamine. Now, this is not advice. I am not telling you to take this. I am simply saying this is what works for me. I mean, if there's other medications like Zofran, which is sublingual under the tongue that absorbs in, which is what, if you get the Meclizine one, it is available as under the tongue or sublingual, dissolvable, chewable. Zofran never seemed to work for me, and it just tastes really gross. So, like, that would always be the first thing they would give me in the ER, and just didn't work. I used to have to get Compazine, and, like, I think there was other ones, I don't remember, that they don't really use anymore, because Zofran is supposed to be so much better. It's not for everyone. But, so if you are noticing that you are having intense periods of vomiting, and, like, the best way to describe, like, my stomach might feel a little bit queasy, which could be from my pain, it could be from my GERD, it could be from the Crohn's, it could be something with Ehlers-Danlos. I mean, it could be so many things with me. And sometimes I just, like, I was diagnosed with gastroenteritis at 2 months old. It was the first time I ever had anything GI related. So when I say I've been dealing with this stuff for my entire life, I've been dealing with this stuff my entire life. So it's not new, recent diagnoses. I'm just finally have a platform to advocate for it. But for me, and I've actually talked to many other people that also deal with this, because, you know, we always find each other in the community because we need support, because people don't necessarily understand. We've discovered, or we have seen, that you'll get the watering in your mouth, like that rapid watering. It's almost sweet, and like your mouth fills up with saliva. That for me is an indication that I have like 30 seconds to get to the bathroom or receptacle or something. And then it'll be like just sweating. I will just start sweating. And that I also know is then, yep, this is the cyclic vomiting. It's not, I ate something bad, which I don't really eat anything quote unquote bad, because I eat the same shit every day. Because I know what my body can tolerate and what it can't at this point. So, yeah, that's one of my fun diagnoses. It's not glamorous, but if you're like many people that are going, oh my gosh, I have all these things, nobody knows what it is, the doctors don't know. You're not going to know until you start doing research. And honestly, I don't know if there is any like golden standard diagnostic criteria other than history. I'm pretty sure it's just a straight clinical diagnosis, which means that it's based on your history and symptoms. So if you are finding that you are having these bouts of vomiting, which can last from hours to days and weeks, and in between, like, you're fine. Like, there's nothing wrong with, well, as far as that goes, you're not having any symptoms, except for possibly the exhaustion from dehydration. But writing a log of all of your symptoms, including like times, days, where you are emotionally, what the weather is doing, if there's been a change in weather, if you're having like a headache or a migraine, because cyclic vomiting actually can go hand in hand with migraines. Thankfully, my migraines have calmed down after my hysterectomy. And then after I explanted the silicone implant and went with aesthetic flat closure, that has really reduced them. And now I take a once a month injectable medication that has been doing really well to prevent them. So there's that. But yeah, you need, sorry, I have ADHD and I am simply exhausted. And it's only Tuesday. It's going to be a long week, folks. I've been trying to edit videos, but I keep falling asleep because I'm just so tired. And I'm going to fall back asleep probably as soon as I get this done. Fritz, post. Hey, Baba, post. Sorry, ADHD, post. Fritz. Yes, I know, there was a car that went by. It's okay. Luna's joining us today. You say hi, Luna? Say hi to the adoring public. She's like, no. No, Luna. She's camera shy, but she's a cutie. Are you a cute girl? Here I go. Fritz, you're not supposed to bark when you're when you're posted either. Don't get a spicy dog as a service dog. He has attitude. So, anyways, that is cyclic vomiting. If you have questions about it, please feel free to leave comments. I have an email address, jesscarrisyt@gmail.com. You can feel free to email me questions if you don't want to leave them publicly. I understand. So that's just my experience with one of the fun diagnoses that I have. As always, I do have memberships on my channel, whether you're here for my personal stuff or my court videos, or you're here for Fritz and Luna because they are so stinking adorable. You can join and be a member on my channel. I will be doing like members only lives and videos and stuff like that. I will eventually probably come up with some merch stuff. I don't know about that yet. Luna, you can't eat the paper, honey. I know. Sorry, she's trying to eat a notebook. Well, you can't eat the alpaca yarn either. Alpaca yarn. It's in a yarn bowl. I know. She loves alpaca fiber. She's spoiled. Anyways, down below is the link if you want to join as a member of my channel and support me. And also, there's a PayPal link below, which will help support Fritz and Luna and their bark box. Did I say the magic word? Habit. What did I say? Your bark box isn't here yet. I know, it's a couple more weeks. Although I just paid for it. Yes. anyways, sorry for this rambling shit show today. I do not feel good. Obviously my voice is in and out, so you know there's that. But yes, I'm not gonna edit this down, so you guys are gonna see all of this sloppy, messy ass, whatever you call this process. But anyways, thanks for watching. Have a good one, guys. Let's say bye, Luna. She says no.